Hello, curious minds and future medical experts. Welcome back to Life of Medical. I'm your host, and tonight we're pulling back the curtain on one of the most crucial and sophisticated pieces of equipment in the operating room, the anesthesia device, more commonly known as the anesthesia machine. Our episode is titled Behind the Mask: Unveiling the Anesthesia Machine, your guide to anesthesia delivery and safety. This incredible machine is central to ensuring patients are safe, comfortable, and unaware during surgical procedures. Let's explore this marvel of medical engineering. What is an anesthesia device, anesthesia machine, and its core purpose? First and foremost, what exactly is an anesthesia device or anesthesia machine, and what is its fundamental role in patient care? An anesthesia machine is a highly specialized medical device used by anesthesia providers to support the administration of anesthesia. Its core purpose is to precisely mix and deliver medical gases, like oxygen, air, and nitrous oxide, along with inhaled anesthetic agents, anesthetic gases or vapors, to a patient to induce and maintain a state of unconsciousness, pain relief, and muscle relaxation, commonly known as general anesthesia. Beyond just delivering these agents, modern anesthesia machines also integrate sophisticated ventilators to support or control the patient's breathing and advanced monitoring systems to continuously track the patient's vital signs. Essentially, it's a life support station that allows surgeons to perform complex procedures safely and humanely. How does an anesthesia machine work to deliver anesthesia and support the patient? Now, let's delve into the fascinating question of how an anesthesia machine actually works to deliver carefully controlled anesthesia and provide vital life support. The process begins with a supply of medical gases, typically oxygen, nitrous oxide, and medical air, from either wall outlets in the hospital or cylinders attached to the machine. These gases flow through pressure regulators and flow meters, allowing the anesthesia provider to precisely control the flow rate of each gas. To deliver inhaled anesthetic agents, which are liquids at room temperature, the machine uses specialized devices called vaporizers. These vaporizers convert the liquid anesthetic into a precisely controlled concentration of vapor, which is then mixed with the fresh medical gases. This anesthetic gas mixture is then delivered to the patient's breathing circuit. The integrated ventilator within the machine then delivers this mixture to the patient's lungs, controlling their breathing by delivering set volumes or pressures at a set rate. Simultaneously, extensive patient monitoring systems track heart rate, blood pressure, oxygen saturation, carbon dioxide levels, and anesthetic gas concentrations, ensuring patient safety throughout the procedure. Where are anesthesia machines exclusively used? Considering their critical function, where are these complex anesthesia machines exclusively used within the healthcare landscape? The primary and most well-known location for anesthesia machines is the operating room or operating theater in hospitals and surgical centers. This is where most surgical procedures requiring general anesthesia, regional anesthesia with sedation, or monitored anesthesia care take place. However, their use extends beyond the main OR. You'll also find anesthesia machines in labor and delivery suites for managing pain during childbirth, including the administration of epidurals or general anesthesia for cesarean sections. They're used in endoscopy suites for procedures like colonoscopies or gastroscopies that may require deeper sedation or general anesthesia. Interventional radiology suites and cardiac catheterization labs may also have anesthesia machines for complex procedures. Essentially, any location where a patient needs controlled sedation, general anesthesia, and intensive physiological monitoring during a medical procedure will necessitate the presence and expert operation of an anesthesia machine. When is an anesthesia machine essential during medical procedures? When does a medical procedure necessitate the use of an anesthesia machine? An anesthesia machine becomes essential whenever a patient needs to undergo a procedure that would otherwise be too painful, lengthy, or require a level of stillness and muscle relaxation that cannot be achieved if they were awake or only lightly sedated. This most obviously includes most major surgical operations, from heart surgery and neurosurgery to joint replacements and abdominal surgeries, where general anesthesia is required to ensure the patient is unconscious, feels no pain, and has relaxed muscles. It's also crucial for many less invasive but still uncomfortable or lengthy procedures where deep sedation or monitored anesthesia care (MAC) is provided. Even some diagnostic procedures, particularly in pediatric patients or very anxious adults, might utilize an anesthesia machine to ensure patient safety and cooperation. Essentially, if the plan involves rendering a patient unconscious or significantly sedated while ensuring their breathing and vital functions are meticulously supported, the anesthesia machine is indispensable. Why is the anesthesia machine a cornerstone of modern surgery and patient safety? This leads us to understand why the anesthesia machine is considered such a cornerstone of modern surgery and a critical component of patient safety. Before the advent of effective anesthesia and the machines to deliver it safely, surgery was a brutal, hurried, and often fatal endeavor. The anesthesia machine has revolutionized this by allowing surgeons the time and an immobile, pain-free patient needed to perform intricate and life-saving operations. Its ability to deliver precise concentrations of anesthetic agents, control ventilation with high accuracy, and continuously monitor vital physiological parameters allows anesthesia providers to tailor the anesthetic to each patient's specific needs and respond immediately to any changes in their condition. Integrated safety features, alarms, and pre-use checklists further enhance patient safety by minimizing the risk of human error or equipment malfunction. It has transformed surgery from a last resort to a routine and overwhelmingly safe intervention for countless conditions. Who operates the anesthesia machine and ensures patient safety during anesthesia? Operating such a complex device and managing a patient under anesthesia requires specialized expertise. So, who is responsible for this critical task? The anesthesia machine is exclusively operated by highly trained anesthesia providers. This includes anesthesiologists, who are medical doctors, MDs or DOs, specializing in anesthesiology, perioperative medicine, critical care, and pain medicine. In many countries, including parts of the US and Europe, certified registered nurse anesthetists, CRNAs, or anesthesiologist assistants, AAs, working under the supervision of an anesthesiologist or independently, depending on local regulations, also administer anesthesia using these machines. These professionals undergo extensive education and training to understand the pharmacology of anesthetic drugs, the physiology of patients under anesthesia, the intricacies of the anesthesia machine and its monitoring systems, and how to manage any emergencies that may arise. Their constant vigilance and expertise are paramount to ensuring patient safety and well-being throughout any procedure requiring anesthesia. Key components of an anesthesia machine. To appreciate its complexity, let's look at some key components of an anesthesia machine. Gas supply system. This includes connections to piped medical gases, oxygen, nitrous oxide, air from the hospital's central supply, as well as backup gas cylinders attached directly to the machine. Pressure gauges and regulators ensure safe and consistent gas pressures. Flow meters. These are tapered glass tubes, rotometers, or electronic displays that allow the anesthesia provider to precisely control the flow rate of each individual gas being delivered to the patient. Vaporizers. These specialized devices are calibrated to add a precise amount of volatile liquid anesthetic agent, like sevoflurane or desflurane, as a vapor into the fresh gas flow. Modern vaporizers are temperature and flow compensated. Breathing circuit. This is the system of tubing that delivers the anesthetic gas mixture from the machine to the patient and carries exhaled gases away. It often includes a carbon dioxide absorber to remove CO2 from rebreathed gases in a circle system. Ventilator. An integrated mechanical ventilator that can control or assist the patient's breathing, delivering set volumes or pressures of gas. Monitoring systems. A suite of monitors displaying vital signs like ECG, blood pressure, oxygen saturation, pulse oximetry, end-tidal carbon dioxide, capnography, anesthetic agent concentrations, and airway pressures. Scavenging system. This safely removes waste anesthetic gases from the operating room environment to prevent exposure to healthcare personnel. Patient safety features of modern anesthesia machines. Modern anesthesia machines are engineered with numerous patient safety features. These include an oxygen failure alarm that sounds if the oxygen supply pressure drops too low. Many machines have a hypoxic guard system, minimum oxygen flow or ratio controller, designed to prevent the delivery of a gas mixture with less than 21 to 25% oxygen. Pressure relief valves in the breathing circuit prevent excessive pressure buildup in the patient's lungs. Integrated monitors have alarm systems for various physiological parameters, e.g., low oxygen saturation, high airway pressure, disconnection. Pre-use checklists are mandatory to ensure all components are functioning correctly before each case. Vaporizers are often interlocked so that only one can be turned on at a time, preventing accidental overdose. Many machines also have backup battery power for the monitors and ventilator in case of a power outage. These redundant safety mechanisms are crucial for minimizing risks. The different types of anesthesia delivered briefly. While the anesthesia machine is most associated with general anesthesia, it supports various approaches. Let's briefly touch upon the different types of anesthesia delivered. General anesthesia. The patient is completely unconscious, unaware, and feels no pain. Their breathing is usually managed by the ventilator on the anesthesia machine. This is for major surgeries. Regional anesthesia. This involves numbing a specific region of the body, e.g., an arm, leg, or the lower half of the body with an epidural or spinal. The patient may be awake or sedated. The anesthesia machine is crucial if sedation is deep or if there's a need to convert to general anesthesia. Monitored anesthesia care. This involves an anesthesia provider monitoring the patient's vital signs and providing sedation and analgesia, often for diagnostic or minor surgical procedures. The anesthesia machine is ready for support or conversion to general anesthesia if needed. The machine's monitoring capabilities are vital here. Even in cases primarily using regional techniques, the anesthesia machine provides a safety net and the ability to supplement with oxygen, manage ventilation if sedation becomes deep, and rapidly induce general anesthesia if the surgical or patient needs change. What happens before, during, and after anesthesia with the machine? Finally, let's look at what happens before, during, and after anesthesia with the machine. Before, the anesthesia provider performs a thorough preoperative check of the anesthesia machine, following a detailed checklist to ensure all components, gas supplies, ventilator, monitors, and safety features are functioning correctly. They draw up medications and prepare the necessary airway equipment. During, the patient is connected to the machine's monitoring devices. Anesthesia is induced, often intravenously, followed by inhaled agents via a mask or breathing tube connected to the machine. The anesthesia provider continuously monitors the patient's vital signs and the machine's function, adjusting anesthetic depth, fluid administration, and ventilator settings as needed throughout the surgery. They manage any physiological changes and ensure the patient remains stable and appropriately anesthetized. After, as the surgery concludes, the anesthetic agents are discontinued. The anesthesia provider manages the patient's emergence from anesthesia, ensuring they are breathing adequately on their own before the breathing tube is removed, if one was used. The patient is then transferred to a post-anesthesia care unit, PACU, for continued monitoring, while the anesthesia machine is prepared for the next case. The machine's data may also be recorded for quality assurance and record keeping. And that provides us with a comprehensive overview of the vital anesthesia machine. It's a testament to medical engineering dedicated to patient safety and enabling the incredible life-changing work done in operating rooms every day. I hope this detailed exploration has been enlightening. If you found value in our journey behind the mask, please give this video a thumbs up, subscribe to Life of Medical, and activate that notification bell for more medical technology insights. Stay curious, stay informed, and we'll see you in the next video.